Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, side effects of digitalis or digoxin. The side effects of digoxin are so. First, we have non-cardiac side effects. Among the non-cardiac side effects, the most common side effect is nausea. The patient with digoxin toxicity can also present with delirium or gynecomastia and yellow vision. Yellow vision is called as xanthopsia. Yellow vision is called as xanthopsia. Then, if you were asked what is the earliest manifestation of digoxin is anorexia is the earliest manifestation of non-cardiac manifestation or side effect of digoxin toxicity. Now, cardiac side effects. Cardiac side effects are mainly arrhythmias are the main cardiac side effects. So, most common type of arrhythmias which is seen in digoxin toxicity is actually a premature ventricular beats, or we can also see it is a ventricular bigeminy is seen. Then, if you were asked what is the most characteristic cardiac arrhythmia, the most characteristic cardiac arrhythmia is actually a paroxysmal atrial tachycardia, or it is also called as non-paroxysmal. It is also called as non-paroxysmal supraventricular tachycardia with variable heart block. We also have other complications, other arrhythmias are, we can see AV junctional rhythms can be seen with the help of can be seen as a side effect of digoxin. Ectopic beats are reported, partial heart block is reported, even the bigeminis, that is ventricular or atrial bigeminis or trigeminis or quadrigeminis are also reported. Then, this digoxin will also convert the atrial flutter to atrial fibrillation. Okay, the important thing is this digoxin will this will never cause two arrhythmias. Digoxin will never cause atrial flutter, and that is the reason why this converts atrial flutter to atrial fibrillation, and it will never cause Mobitz type 2 block. Then, arrhythmias are seen even at therapeutic dose. Then, now there is digitalis treated arrhythmias. Now, what is the treatment of these digitalis treated arrhythmias? Treatment of digitalis treated arrhythmias include: first, when the patient presents with any type of arrhythmias due to digitalis, first they should be treated with anti-digoxin antibody. They are treated with anti-digoxin FAB fragments. Then, if the patient has bradycardia or if he presents with bradyarrhythmias, then you can do atropine is given and cardiac pacing can be done. If the patient presents with any tachycardias or tachyarrhythmias, then potassium is given. If the patient presents with supraventricular tachycardia, then propranolol can be given. If the patient presents with ventricular tachycardia, so for ventricular tachycardia, we can give lignocaine can be given to the patient.
thank you and thank you for watching.